sitting in this hammock brings back a lot of great memories that of starting this process.
I remember sitting here about 2 years ago and meeting here, having a talk between friends, and John asking us, how can I help? And just that question brought this great idea of bringing doctors, and the fact that he asked that question, this idea came from Tomas, from Ruth, from local people saying we need medical doctors, and he keep asking that question, and we appreciate that.
We didn't think we'd have a group this big. We didn't think we'd have the support people.
Deseamos que esta jornada médica sea de mucha bendición de parte de Dios y de ustedes para nosotros.
Our hope is that this medical clinic will be a blessing for our community and glorify God.
I think it's really, really important that we as physicians give back as much as we can because we have so much. I think God has blessed me personally with tremendous assets and has kept me safe. And you know, at this phase of my life, I want to give that back. But down here, they have no health care. I met patients that hadn't seen doctors in decades. I mean, they just don't have a physician to go to. So to come down here and give them any free health care is just a magical treat for them.
There was one particular family, and you know, they're just like everything else. They had parasites, and they were tiny little scrawny kids, but they had the most beautiful smiles on their faces. All of them, the whole family was just smiling and happy, and they gave us hugs and kisses. And you know, we get upset because we get stuck in traffic, or you know, the coffee machine's broken, or my blow dryer didn't work, or whatever it is, you know. And then you see these kids who, you know, are like sort of hardcore camping their whole life, you know, and it's never going to end. They don't ever get to go home and take that hot shower and order a pizza. You know, and just to see their joy and appreciation, it just touches you.
Most people approach me as a stranger and want to give me a hug. It's a delightful, trusting community of people.
We had a house call on the first day. We saw a young woman who was just a beautiful young woman, about 17 years old, who was quite ill. She had a fever, and she had a very elevated heart rate, and her symptoms were consistent with pyelonephritis, or a really bad kidney infection. We have antibiotics that we could treat with, and started her on the antibiotics. After lunch, we were informed that she was doing much worse. We went a few doors down to the house where she was living and examined her again. She did appear much more ill and had a much higher fever. So we doubled up on her antibiotics and decided to come back and see her the next day. The next day at 9 a.m. when we went to see her, she was bright-eyed, smiling, and looked wonderful. Stated that she felt better, didn't have back pain anymore, and her fever had sort of broken around 2 a.m. So it was very reassuring to us that we are helping patients, and also that I think reassuring to her and her family that she was going to be better.
So the first time I see Victor, I'm thinking this guy is a village leader, he's the pastor, and he has one leg. And I thought, well, does he have a below knee amputation or does he have an above knee amputation? So I looked at it, it looks like an above knee, and he's walking around on crutches, and I'm like, well, you know, that's going to be hard to do. I said, so I asked him, did you ever have a leg? Did you ever have a prosthetic leg? He said, no, never had one. I'm like, oh, well, we can get you a leg. That's not a big deal because we probably have 1 or 2 laying around the office. If I can get him a leg, I think he'll be a lot happier and he's going to live a better life.
There was this young man named Junior who had been pushed into a fire by an older boy and had burned the front of his leg and his foot very badly, and he was, you know, he was having some trouble with that. The mother really just wanted it to be looked at. He had some trouble walking because of the scar that he had, and so Susie was able to help them with some medication to inject and show them how to care for it so that it would be less of a problem for him and that his foot would grow properly and he wouldn't walk improperly because of it. So he really stands out to me because he had the saddest eyes I've ever seen. Oh my goodness, he was sad. But what was so touching is that Susie spent some extra time with him and went and sought him out afterward and told him, this isn't going to hold you back. This is not something that you should be concerned about. You can do and be whatever you want. And his little face lit up and he like just reached for her and smiled and gave her the biggest hug. It was really, oh, it's so sweet.
It was just a great joy to me to be able to see these kids. The thing that probably struck me the most is just that they had never seen a doctor before, many of them, and we're so grateful for us doing things just like giving them vitamins, things that we so take for granted. The other thing was how many of these kids were malnourished. Many of them were developmentally delayed as well. And the reason likely is that most of them are infected with parasites, so we were asking a lot of them their water source. A lot of them were just getting their water straight out of the pond and just drinking it. We can go in there and do so much, but really the work that the other team was doing of building the water filters is so fundamental. You know, we can't just keep going in and treating for worms and doing the stuff that we did without fixing the source of the problem, which was really a lack of access to clean water.
It really makes me pretty happy to see these water filters lined up that you're working on, because it's the only way we're going to get this fixed and keep it fixed, fix it for a lifetime for those families, so get those water filters. So important work.
We didn't realize, you know, the donations that would come in. We were talking about it. You know, probably over $4,000 in medications were brought here. You know, we brought over 800 toothbrushes and toothpaste. Almost 200 tubes of Neosporin were donated. Probably close to 300 to 400 bottles of children's vitamins. There's no supplies provided except what we bring and other groups bring. So. Pretty exciting.
We're going to visit a clinic in a city in Padaloo where we're dropping off supplies. It's a government clinic. They don't get a lot of supplies, so most of the supplies they've received are supplies we've brought on our last 2 trips. Sutures, dressing. It's a 12-bed hospital that serves a town of 45,000.
It's pretty exciting, you know, all those things that they asked for. So many people contributed to.
I was a little reluctant to come, honestly, because I've never really done anything like this before. But it didn't take long for me to feel like this was a great thing for me to do.
This has been a wonderful experience. A great opportunity to not only practice some of the things we learned in medical school, but to really connect with these Guatemalan residents who are just wonderful people and very appreciative of everything that we have brought here.
Nothing needed to be said to see the love that the Guatemalans had for us and for what we came to do for them. But truly, I got 10 times more love back from them. And even though it broke my heart, some of the conditions that they had to live with, it wasn't breaking their heart. And they were living in joy and in such a close family connection of love that I have not seen in a long time. I love Guatemala, and I love the children and the people of Guatemala. They're in my heart forever.
I went into medicine to help people, and not that I don't help people in my job in the States, but this was so fundamental, you know, to just human love and charity and empathy and all of that stuff that really is, you know, why we're here.
I just can't understand why more people don't do this. It's so fulfilling. In a lot of ways, I don't want to leave. I'm very happy I did this. It's a fulfillment of a long-term dream, and I plan on doing it again soon.
It's something to watch the doctors, nurses, everyone that was involved truly heal. You know, use the talents we were given. I mean, that's what's exciting about it. You know, it's one thing to do it for a paycheck. It's another thing to bring it where it's not available and then offer that to these folks. There's no doubt everybody that's on the team, no matter what your role was, you're gonna be a little different person after this. It's an eye opener, real eye opener.
For us, it has been just humbling to see how a group of well-educated, trained doctors from the United States come down here to a rural village and use their knowledge, their skill to treat people, and with the same respect and the same way they treat their patients in the States, and working probably harder than they work in the States, and having one patient, another, and not very comfortable situations. It's very something that we respect a lot. We have no words to describe how thankful we are.